Is coffee good in the prevention, or is it good to help prevent type 2 diabetes?
No, coffee really doesn't. Well, some people feel if you take a lot of coffee, the possibility of developing cancer in the pancreas is high. Pancreas is the organ that secretes insulin, which controls sugar. Okay, but not many people are developing cancers of the pancreas anyway. But one has to prevent, because so many things cause cancer. So if you can avoid one or two, I feel it's best to, particularly if it runs in the family, like breast cancer, for example. It runs in certain families, and so if you know certain things you have to do to avoid getting it, then it's advisable for you to avoid it. But coffee and heart disease, there have been two different research cited. There was one recently done, a prospective study, analysis of hundreds and thousands of patients who have heart disease and who are taking coffee, okay? And they divided them into two groups, those that took coffee and those that didn't. And the findings suggested that coffee probably has a beneficial effect on those category of patients. But from my experience, I wouldn't follow that. Well, like, the essence of research is for you to tell me, but it's another thing for me to take what you recommend.
You know, Prof, in spite of all of this, as much as one will try to stay healthy, you'll always have emergency cases where you have to rush the people to the hospital. And our emergency services, access to emergency health care is a big challenge in this climate. We need to do something about that.
Well, the story is because the different levels of care, we haven't completely isolated them. Isolated them in terms of primary, secondary, and tertiary. The Lagos State is doing a lot now. It's empowering the primary health centers, because most things that will lead to an emergency can actually be prevented. Okay, so if you go to your primary health centers and you are examined, and it's beyond, they'll send you to secondary facility. And if they can't handle it, most cases are handled at secondary, then it comes to tertiary facility.
How do they deal with the quacks?
Quackery is a big issue in Lagos State too. You have a lot of quacks. We could talk about quackery for, there are categories of quacks. There are some quacks who don't have any medical education and they go practicing.
Wow.
There are some quacks who have semi-literate medical education and they pretend to be specialists. So you can have quackery at different levels. It needs a lot of policing, okay? It needs a lot of policing, but I think we'll get to it. We'll get to it. By the time everybody's registered, like Lagos City, you have to have a registration. Of course, you won't get it registered if you don't have the qualification. And then the limits of your practice also will be defined. A lot of people take on. I've had patients who went to some hospitals let me give you an example of one. A patient came to me and said he's been diagnosed as having cancer of the liver, and that the doctor he saw somewhere in Apapa said he had to pay 1.something million naira.
Wow.
For him to be able to attempt to try and cure him. And I asked him to go and perform an investigation. I discovered all he had was an amoebic liver abscess, an abscess within the liver, which for 25,000 naira admission in LASUTH at that time,
and it was
we
like
aspirated
1.something million.
That is a doctor who is practicing as a quack. Or I hope he's not, maybe he was trying to fleece the man of money, but even then, that's quackery.
That's a professional quack.
That's a professional quack. So, but then we have lots of nursing homes too, who ideally should be seeing patients who are recuperating. A patient is ill, and there's no need to stay in the hospital, he just needs bed rest. And so you go to a nursing home, let them. And all these people will pretend to be doctors and we give him medication and things.
Wow.
Okay.
Well, it's interesting. Unfortunately,
there's one. Someone's.
I know this topic can be addictive,
but don't worry.
Like coffee.
But this time, not coffee. He's asking about frequent shocks.
Frequent
shocks. I don't know if it's electric shock, but it's a mail from O2 in Warri.
Does
it affect the heart condition?
Yeah, electric, the body system works on very microcircuitry of electricity, okay? So if someone gets electrocuted, one of the ways he could die is cardiac arrest. The heart just stops. And they think it happened to the brain as well. So I don't know a situation that will give you frequent electric shock, because once you are shocked, I guess you probably avoid a repeat of the situation. But if a case like that happens, then the patient has to avoid it.
Yeah.